Today we're going to be looking at American tackle football, injuries, treatment, prevention, and rehabilitation. We'll look at common injuries, the common factors, the anatomy of the injury, the mechanism of each injury, treatment, including the assessment, prevention, and rehabilitation. Common factors of injuries in American tackle football include the level of competition. So as the level of competition increases, so does the likelihood of injury. As you can see here, high school injuries occur out of 6 per 1,000 athletes, all the way up to the professionals where 65 out of 1,000 athletes sustain injuries. The position that is played, wide receivers and running backs are most likely to injure their knee. Quarterbacks, offensive line, defensive linemen suffer shoulder injuries. Although the mechanism of injury is a little bit different, the quarterback would be from throwing, where the lineman would sustain the injury from reaching out and the tearing of the shoulders. Linebackers and defensive backs usually have lower limb foot injuries, but it's important to note that linebackers are the most injured position on the field, followed by running backs, and that a defensive player is most likely to receive a concussion during a running play. Also, the time of the season affects how many injuries occur. Preseason is the highest prevalence, followed by regular season and postseason. This is most likely due to the amount of the fitness level that they have and if they're up to game time speed and game conditioning. So lower limb injuries, including the ACL tear, which is one of the worst injuries that you can receive. You can see here what's happening with these two runners is they're getting a little bit of valgus collapse with internal tibial rotation. They have knee abduction movements and then low knee flexion angles, lateral trunk rotation. Again, here we see the same thing, tibial internal rotation, lateral trunk flexion, and then a planted foot always increases the likelihood of this injury. First mechanism of injury is with an external stimuli or an outside source. In this case, we have a player falling into the leg of the injured athlete. You see the lateral trunk flexion, the internal tibial rotation, the applied force, planted foot, and his direction of resistance. This is a non-contact ACL injury, so he's attempting to change direction. He was running directly at us, and now he's attempting to change his direction to his right. The planted foot, a little bit of internal tibial rotation and trunk flexion there, and in this instance, the injury has already occurred just a few milliseconds before this picture was taken. So assessing the potential ACL tear, the Lachman test. So you have the athlete lay supine on a bench, have them bend their knee about 20 to 30 degrees, stabilize the femur with one hand, and then grab behind the gastrocnemius with the other hand and attempt to pull that knee forward out of joint. It should stop, but if there is any translation past that top stopping point, that's indication of an ACL tear. Treatment, you can have ACL reconstructive surgery, which happens a lot of times with athletes who are going to continue in sport, or you can have a conservative non-surgical, which some people decide to go that way because they're not going to be using it in an explosive type of surroundings or setting. Prehab exercises include triplanar jumping and jump landing. We have a YouTube video here that shows performing this. You can perform it for 20 minutes one time as you lead up to your workout for the day, or you can do it individually as just an exercise program. Walking lunges is another good way to practice keeping the knee in the desired location or position. We don't want the tibial internal rotation. We don't want the knees coming out too far, and we don't want the knee passing the toes, translating past the toes. Rehabilitation. The heel slide is a good way to gain back some strength in that quadricep and regain the range of motion. Again, there's a YouTube video there showing how to perform that. Another good way is the Bosu ball balancing, and the progression there is starting with the flat surface, the hard surface of the ball, so you have a nice solid place to place your foot. Flip it over as you progress, and you can use the rubberized side of the ball for increased instability, which helps to really fire all those stabilizing muscles around the knee. And then you can further go with that with cognitive awareness and have somebody toss a ball to you as you balance on that one injured leg. Upper limb injuries, so fractures. In this instance, we see fractures to the forearm, and that can be a result of, as you see here, contact with the ground or contact from another player. And what's happening anatomically is there's a force that's applied to the forearm bones, either one or both, the radius and or the ulna. And there's two different fractures that you see here. An open fracture is where the bone punctures the skin and sticks out, and in that case you might see a false joint where it looks like there's an extra bending point there, or you'll have the closed fracture where the bone does not puncture the skin. Mechanism of injury, outside source. So here you have pressure applied by a tackling opponent, and then you have here the ground. The player is attempting to catch himself and brace his landing, and he does that by breaking his arm. So the identification and assessment, the best way to tell is the eye test. If there's any type of deformity or a false joint, that's an immediate indication of a fracture. You can check for tenderness and swelling and sensation and movement. And if you suspect a fracture, then you need to brace it until you can get it x-rayed by a professional. So initially you'll rice the injury, splint it until you know which definitive care program you're going to go after, which you'll have one which is surgical treatment, open reduction to fix the broken bones, or conservative non-surgical, which is casting without surgery. Prehab exercises, forearm stretch and strengthen. We have a YouTube video here showing that. You'll flex and extend your fingers. General strengthening program, that'll be any type of upper extremity exercises that you perform, push-ups, anything where you're holding a weight, and this is just generally increasing the exercise of the muscles that surround the bones of the forearm. Rehabbing, you'll have wrist curls, which is basically like your prehab, but here you'll start out a little bit slower with less weight, go 10 to 15 reps until you gain that motion back and the proper flexion and engaging of the muscles in the correct order. We have a YouTube video for that one as well. And then elbow curls, if you have been braced above the elbow, you'll atrophy those elbow flexor muscles as well. So you need to re-strengthen those, not just the wrist muscles. Finally, a major concern in tackle football is concussions. And this is when, as you can see, the brain is jarred inside of the skull. And it's a bouncing or twisting in the cranial cavity, resulting in bruising or bleeding. Post-concussion symptoms include dizziness, fogginess, and mild difficulty affecting the memory. So sometimes people aren't going to remember exactly what they just did, what they've done throughout the day, and or they're having a hard time concentrating. It's hard for them to concentrate and they may have headaches. Mechanism of injury on this one is a head-to-head contact, and this usually occurs when a player dips their head down and doesn't keep sight of what they're tackling, and they use their head as a striking object as opposed to the shoulder, which is the proper way to tackle. The second mechanism of injury is head-to-ground contact. A lot of times when a player is tackled, their legs get taken out from under them, they flip in the air, and they land on their head, compressing the neck and the spine and causing the brain to be jarred inside the helmet and inside the skull. Identification and assessment. You can use the SCAT, which is a Sport Concussion Assessment tool, and it identifies the trauma to the athlete. It does memory assessment, symptoms assessment, cognitive assessment, a balance assessment, and neurological assessment. Treatment, you really need mental and physical rest. You need somebody to test and observe and treat you for the symptoms that you may develop over the time after sustaining the injury. So testing is just your visual, your hearing, your strength, and your balance, memory. And if it's necessary, a CT scan will indicate if there's trauma there. Caregiver needs to observe you to make sure that these symptoms do not get worse over the first 24 hours. And then the treatment would be for headaches. You can treat it with just acetaminophen. Rehab exercise is really no way to completely reduce the likelihood of or eliminate the likelihood of a concussion, but there are ways to reduce the likelihood. Heads up tackling, so teaching proper technique is really important. You find it in a lot of schools, high schools, colleges, even the pros use it. Proper tackling form, and there's a progression there, short steps to slow the body down. You have the arm swing, low center of mass, and the most important is keeping the head up, not using it as a striking object, which helps to eliminate some of the compression of the neck and then jarring of the brain in the skull. You also have a YouTube video there. And then you can use neck strengthening exercises. As the neck increases in strength by 1 pound, it decreases the likelihood of a concussion by 5%. So 2 to 3 sets of that, 10 to 15 or 20 to 15 in each direction, flexion, extension, and then lateral flexion, both sides, 2 to 3 times per week. And you can perform it isometrically to begin with, maybe taking the hand and pushing against the hand first, and then you can add weight with the neck harness if so desired. Rehabilitation, so you'll have return to sport protocol, and that's a 24-hour period for each of the steps in the progression. And then you'll have light aerobic activity, sport-specific exercise, non-contact training drills, and so on. And then another important thing is to limit mental exercise. We have a YouTube video here showing how to do that, but it's important that not only to limit physical exercise, but we need to limit the mental and visual exercise that our brain is undergoing, because that's added stress that helps to reduce the likelihood of a quick recovery. Here are our references. Thank you.